This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945. Hey everyone, welcome back to another episode of The Beat, recorded live at Vive in Nashville, Tennessee. Today I have the privilege of hosting Vijay Verma on the podcast. He is the Vice President of Product Management at TeleVox. He's got a proven track record of successfully implementing strategies to drive customer engagement and increase customer satisfaction, which is something that we're all after in the business of healthcare. So Vijay, thanks for joining me today. Excited to have a conversation with you.
Absolutely. Happy to be here.
Awesome. So let's get into it. Talk to us about your organization. How are you guys helping to drive change in healthcare delivery?
Yeah, absolutely. So TeleVox is a healthcare IT company, and our specialty is bridging the communication gap that exists between the hospital systems or provider practices, as well as the patient. Right? So that's the main thing that we solve for. And our thesis is good outcomes can be built on strong communication platforms and communication experiences. And a good communication experience has to work for both sides of the conversation. It has to work for the institutions as well as for the patients. So we've launched multiple solutions and experiences that handhold a patient throughout the patient journey, be at every step of the way, whether that is discovering the level of care that they want or preparing for an upcoming appointment. And even when the appointment is done, getting the right information at their fingertips so they stay on a healthy track. So that is essentially what TeleVox aims to provide: good clinical outcomes backed by solid customer experience, which in return drive financial outcomes for the institution.
Yeah, and at the end, it's all about communication. I was thinking about communication, that word last night. I was thinking communication, and it's such a vital part to putting it all together. It's the glue.
Yeah, absolutely. Like that's a very interesting take on the word communication. And yes, in this, especially when it comes to healthcare, it does take a community to positively impact health outcomes, which is effectively what all of us want.
Yeah, that's great. And so, look, there's a lot changing in healthcare and in technology. What emerging trends and technologies do you think will have the biggest impact on healthcare over the next 5 years, Vijay?
Yeah, I think generative AI is like one word that we have to talk about. And before we get into what generative AI is, we should talk about why that's an issue. We talk about there is going to be a shortage of physicians going forward. There's going to be a shortage of nursing going forward. And healthcare in general is not getting simpler to implement, simpler to practice. And the solution for that is unfortunately going to be more people in the mix that can help improve. Technology has a big role to play, and that's where generative AI specifically has a huge role to play in making the staff that is still left, who still wants to do this willingly. Generative AI can help reduce the burden on their staff to help them take care of more patients in a responsible, empathetic, and in a impactful manner. Right? So that's basically what I would pick. One word would be generative AI.
Yeah, it's well said. And we're learning more about it, and there's more efficient ways to do it than we initially thought.
Absolutely. Yeah, absolutely. Especially in the last 2 years, 2 to 3 years, not only the efficacy of generative AI has improved, the cost of using generative AI has gone down quite a bit, and the acceptance of this technology by part of the practices, institutions, by the physicians, by the nursing, and more importantly, by the patient has gone up significantly because they're comfortable with this concept and they see what value this tool can provide in improving the clinical outcome.
Yeah, no, for sure, Vijay. And thinking about what providers go through on a day-to-day, week-to-week, month-to-month basis, what are the biggest pain points that your organization's helping solve?
Yeah, the biggest pain point still remains, how do you get the right people to talk in a channel that they want to talk in, reducing the friction along the way. What ends up happening is there are some institutions that will basically say, here is a 1-800 call now number, call us, And on the patient side, it is, if I call, how long will I have to stay on hold? Will I get the right person at the right time? Is it really worth spending 20 minutes of my time getting this information? They would rather have a more convenient and easy access to that information without the burden of a communication channel barrier, right?
Mhm.
But on the flip side, you just can't have every single conversation, communication going to the institution because that creates a burden. It results in staff burnout in handling all the communication, right? So that's kind of the problem that we are looking to solve in a responsible, but a scalable, and as well as an empathetic manner.
Yeah, that's interesting. I think of a typical experience, say on a flight, if you want to change it,
Mm-hmm.
right? They've gotten pretty efficient with the chatbots. I used to
Yeah.
not like them,
Yeah.
but I feel like the airline industry has nailed it.
If you look at the issues that happened in the last 2 years, I think they still have a room to play. But yes,
Or at least close, right? Like
it's
they've
close.
gotten close.
It has
They've
gotten better.
close.
Right? Yes, there are some industries that absolutely do it better than others, right? And where you see the patterns of where it is actually better is it is a personalized information, it is a proactive communication,
Mhm.
and it is a automated conversation. Let's say you have a flight and it's going to be impacted by weather, like which is going to happen to some of the folks in Vive.
Yeah, it already has. And
It already
we're
has,
going
right?
through it.
Yeah. So you
All
call
of
the
us.
number, right? And if the airline experience was, okay, what's your name? Which flight are you booked on? What's your confirmation code? Like that's a pretty laborious. It takes like 2-3 minutes to get past, right? But if it basically said like, I know you are calling from this phone number. This phone number is linked to your profile. I'm going to send you a one-time confirmation code to confirm that you are who you are. And once you confirm it, I see you are on a flight that is currently impacted by weather. Here are 3 options you have to choose from. Which one of these works for you? You will do it, right? So that's
I just did it.
Yeah?
I just did it yesterday. Like,
Yes, yeah.
I got my 3 options. Like that was literally what happened.
Yep. So now, historically, what has happened is a lot of industries and companies have built this in the mobile app. So you launch the mobile app, it is personalized, it is proactive, it is an automated flow. But we don't necessarily do the same thing on a voice. We don't do the same thing on an SMS, which is what would be a channel of choice. We're taking the channel of choice away from the customer. We're basically saying, if you want best experience, come to this channel, which is a mobile app, but that may not be the channel that's most convenient for someone else, right? So what's needed from a better holistic customer experience is this omni-channel. It should work the same way, irrespective of which channel you're in. In some cases, voice has a huge role to play. And I worked with customer experience industry for like good 10 years now, and I've spent a lot of time and effort reducing the inbound phone calls. However, inbound phone calls still remain a huge, one of the biggest touch points from a customer's point of view. And there's a reason why. Sometimes the person who's calling knows that this is a complicated conversation.
Yeah, right.
I don't want to type so much. I know this will not be fully automated. I need to explain to someone, which is where voice is needed,
right?
Which is why voice still has a huge role to play, and especially when it comes to healthcare. If someone is sick, there is no amount of technology you can put in front of that person which will make that person not want to talk to a human, right? So voice has a role to play, and combined with generative AI, I think we are at a point where we can make a voice so much more smarter, so much more effective, not only for the patients, but also for the institutions involved.
Well said, Vijay. Well, let's talk about Gen AI. It's a topic on all of our minds. Everyone's using it. It means a lot of things to a lot of people in the healthcare world.
Yes.
What does Gen AI mean in the patient relationship management and patient engagement landscapes that TeleVox plays in?
So yeah, we touch on generative AI as a tool that's now available. So let's talk about what generative AI is. So even in healthcare, generative AI has multiple applications. So we talk about ambient dictation. That's an example of generative AI. We talk about creating patient personas to help with clinical training. That's another example of generative AI. We talk about simulating patients with different languages. That's another example of generative AI. Where TeleVox has taken generative AI, which is our strong wheelhouse, is how does this impact customer experience, right? So for us, historically, again, hospital systems have struggled with creating helpful content that works across different channels. Voice needed a different content management system. SMS was somewhat limiting because 140 characters. Handling multiple languages was a lot harder because there was only how much you could build and scale.
Mm-hmm.
We have taken generative AI to essentially take with a simple one-channel conversation and use generative AI to convert that into providing specific, customized experiences that work across different channels as well. So if you have a website that says, here are 5 steps to follow for rebooking your appointment, we can take the same content and make it available in a voice channel or an SMS channel or any other interaction that the customer is looking for without creating any more work for the hospital system, right? So that's how we take generative AI, by taking the experiences that exist and having them scale across different channels. And more importantly, even within those channels, like having it expand to multiple languages. So for example, if you have an English-based FAQ on where do I park, what insurances are accepted, you don't have to create the same version of the same document for 10 different languages. We will leverage generative AI to make the same content work for different languages. You don't even have to pre-create documents for like different languages. We will just do this on the fly because technology is there. It has met that threshold where it can just handle this on the fly, as opposed to doing the manual recreating this document in a laborious manner.
I love that. And so when providers sign up with you guys, they have this capability. They take their documentation and now they could repurpose it in an omni-channel way to meet patients where they're at.
Yes, absolutely. Somewhat on the cutting edge side of the conversation is after visit summary. You go to a doctor's appointment, they'll give you like, here are 10 pages printed documents of instructions to follow for the procedure that you just had, right? And in most cases, those 10 pages of documents, they just sit on a sofa somewhere and nobody ever finds this.
Yeah.
And if the patient has a question, they will pick up a phone call and call, right? And that is less than optimal patient experience. And that is less than optimal care team experience. We can take the same content and now make it discoverable. So if let's say you and I have different procedures at the same hospital system, our appointments get done, and then you and I call in and ask a question. TeleVox as a system will know that these two patients had different procedures. So their questions should be answered based upon different content base, and we are able to personalize that information based upon what we know about the patient, what information was shared, and then still have it discoverable in the channel of our choice as well as the language of our choice.
So very interesting. And SMS, talk to us about how that channel would best be leveraged.
Yeah, excellent. So if you think about your own personal lives, you probably spend a lot more time texting in your close circle, friends or family.
Yeah, for sure.
There are scenarios where SMS is good for short, quick conversations, right? What we have done as an industry is less than optimal. We tend to use SMS as a notification channel. Here is your reminder. Are you going to come for your appointment? Yes or no? And after that, the channel goes dead. Right? So if the patient has a follow-up question, the channel goes dead. What TeleVox offers is smart SMS, which is persistent, actionable, conversational. So once you establish the conversation channel between the patient and the institution, the channel stays open for any follow-up questions that the patient might have. So even if you've confirmed your appointment and then you ask a question around, hey, where exactly is this appointment located? Which one of these 3 campuses is this appointment in? That SMS channel will be able to look up that information and respond, which is what makes it smart, right? So it's not just a one-way,
that's great,
short-lived conversation dialogue. It stays on. And this is, another example of where we use generative AI, because SMS as a channel has, somewhat limiting constraints, 140 characters. You have to fit right information in the right time so it is useful. And we are able to build that experience in a fully automated manner without the institutions having to do any legwork.
That's great. And look, very exciting, right? A new approach. You keep it open. You're able to ask questions, meet patients, meet us where we are. That sounds interesting, but tell me more about smart voice. I know that you guys are also working on that. Tell me more about that.
Yeah, so we touched on it in a previous scenario. So SMS works for short, directed conversations. As I said, there are scenarios which will require a lot of information going back and forth, and typing is not necessarily the right channel for this. And on top of it, our thesis is voice is still personal. It has a very special meaning to all of us. But historically, voice has struggled because if you call in even to the airline example that we talked earlier, it would typically say, press 1 to book an appointment, to book a new reservation, press 3 if you need help with an existing reservation. That kind of a directed model, while somewhat reduces error, is not naturally intuitive to use, right? What Smart SMS offers is a fully conversational experience, pure natural language, and you don't have to like press like random buttons to say like I want this. You can talk naturally, and the system will respond in a natural tone as well. And you will get the benefits of the voice, which is convenient, low typing, empathetic experience. And you get experience, the value of automation, because whatever scenarios we can automate, we will still automate. And what we cannot automate, we will connect you to a human who can best help, knowing that this person, let's say it's an international patient looking for a referral for a colonoscopy. We will connect them to your staff who is specifically trained to handle those scenarios. So it reduces the hops and bounds that come into play when you don't plan a smart system, right? So voice for us is empathy of a voice channel, automation of a virtual agent, and then smartness of a call center. That's what smart voice is for us.
I love that. Yeah, it sounds very useful. And I'm sure everybody listening, you're thinking about experiences you've had with voice and in your care journey.
Yeah.
Could it have been more smooth instead of pressing a button?
Yes.
Having it a little bit more authentic and genuine.
Conversational.
Conversational is the word.
Absolutely. Yeah. And not having to spend like 10 minutes on hold and then another like 10 minutes, jumping from one call center to another.
Yeah, that's great. Well, look, Vijay, super interesting. I love what the company's doing to add value to the providers in our space. If somebody wants to learn more, how can they reach out to you and the team?
Yeah, just go to televox.com. Our website has a lot of information on the products and services we offer. We have case studies from how different hospital systems have used our solutions. Just drop a note and would love to talk to you more.
I love it. Folks, make sure you check out the show notes where you could see all the ways to get in touch with Vijay Verma, Vice President of Product Management at TeleVox. Vijay, thanks so much for being with us.
Absolutely. Thanks for having me.
This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.